Hello, my friends. This is Dr. B, the best doctor in medicine. 30 plus years of experience in medicine. 30 plus years. Today I need to talk to you about the second blood test for early detection of Alzheimer's dementia. Second blood test approved by the FDA, right? The American FDA, Food and Drug Administration. I posted another video a few weeks ago about the first blood test that was approved by the FDA for early detection of Alzheimer's dementia. That was a blood screening test, but it was a genetic test, right? Genetic screening test for Alzheimer's dementia. Please look at that video that I posted. Today I want to talk to you about the second blood test that was just approved by the FDA. And this time it's not a blood test that is a genetic screening test. It's a biomarker screening test for early detection of Alzheimer's dementia. Guys, remember that Alzheimer's dementia is the number one cause of dementia all over the world. In the United States, more than 8 million people are currently living with Alzheimer's dementia. And every year, the number of people diagnosed with Alzheimer's dementia increases because of many factors. Number one is, of course, people live longer because medical care, surgical care, prevention, blah, blah, blah. And also because we've been taking all these pesticides, insecticides, carcinogen, nasty stuff, dyes and everything in our food since we were little toddlers, right? Who knows what is the effect, long-term effect of all these nasty pesticide and chemicals that we have in our water, in our food, that they put the dyes, the pesticide, all this nasty stuff, the pollution in the air, and blah, 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 blah. So over the long term, it damages the brain. We haven't determined yet a precise cause of Alzheimer. We know that there is a gene that can increase your risk. Look at that video that I posted. It's the ApoE genetic screening test for Alzheimer's disease. Today I want to talk to you about the second blood test that has been approved. That is a biomarker test. So please, if you or your wife, your husband, your family members, anybody, daddy, mommy, uncle, brother, sister, husband, wife, anybody is developing early signs of dementia, early, like short-term memory loss, right? Brain fog, mild disorientation. People are different. And you know your wife, you know she's different. You know your husband, you know he's different now. You know your sister, your brother, your mom, you know something is wrong, right? Do not allow your family doctor, your internist, your family practitioner to dismiss your symptoms of brain fog or early dementia or short-term memory loss as just aging. No, it's not. You can age but still be sharp like when you were 20 years old, and that's the normal aging, all right? Alzheimer's disease usually starts with short-term memory loss. Go to see your doctor, become your own healthcare advocate, and ask for that blood test called biomarker screening test for Alzheimer's dementia. You can also do the genetic screening test for Alzheimer's dementia. So you ask your doctor, and if your doctor doesn't understand it, you tell him to watch my video, right? Listen, It is very, very important to diagnose Alzheimer's dementia early when it's just starting, because now we have a medication that they can give you one time per month, that can not only stop the progression of the dementia, but even according to all studies, reverse it by removing the nasty plaques of beta amyloid that is depositing in your brain cell and killing them, right? So do not be like the Hollywood actor Bruce Willis, whose dementia was diagnosed too late. So he cannot benefit from the medication, IV medication, one time per month. One time per month you go to the clinic or hospital, they give you that Kisunla medication to treat your dementia, to reverse course, so that you can enjoy your retirement. Guys, remember, if you do not become your own healthcare advocate, your own healthcare fighter, you will not be diagnosed early. So they're going to miss your cancer. It will be detected late. They're going to miss your heart failure. It will be detected late. They will miss your dementia. It will be detected late. Do you understand what I mean? They're going to miss your fatty liver. It will be detected late. And when any disease is detected late, then the prognosis is bad. Right? You want to detect any pathology, any disease early, so that you can implement treatment early, whether it's medical treatment, surgical treatment, whatever it is, or a combination of both, or radiation therapy, blah, 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 so that you can fight the disease and enjoy the retirement in the years to come, right? So remember, don't be like Bruce Willis. If you know that your memory is not what it was, especially when it comes to short-term memory, you forgot where you put your car keys that you just put somewhere a minute ago. You forgot where you put your eyeglasses that you just removed to wash your face, blah, 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 blah. You forgot just where you put your cell phone just a minute ago, right? There's something wrong with you. Right? If you have brain fog, means you constantly cannot concentrate. There's something wrong with you. You know that. Do not allow your family doctor, internist, family practitioner to dismiss it, to say, well, you're getting old, or well, maybe you're not sleeping enough, or maybe you should have some caffeine, blah, blah. No. You deserve proper, individualized, tailored, custom-made healthcare. You deserve proper healthcare, which unfortunately millions of people are not getting in the United States. I posted a video about that, and it's gonna get worse and worse and worse. I swear to God, it's gonna get worse. You think healthcare gonna get better? Well, sit down, because it's gonna get worse and worse and worse every year, because our population is climbing in number. We are 350 million people already as of June 2025. It's going to get even worse. The population is rising. Our national debt is increasing. Our budget deficit is increasing. The federal government is bankrupt. The state governments are bankrupt, right? So you need to advocate for yourself. You need to become your own healthcare advocate. You need to become your own healthcare militant, right? Do not entrust your health 100% in the hands of your doctor. Trust your doctor 90%, but 10% you have to do your own research by watching my videos, by following my recommendations, right? And by knowing what the cazzo is wrong with you, right? So remember, your only chance, whether it's you, your wife, your husband, your brother, your sister, your kids, your mommy, daddy, auntie, uncles, your only chance of overcoming Alzheimer's disease is to detect it early, if you detect it early by either of these two blood tests, the genetic screening blood test or the biomarker screening blood test, that's it. Then you can have the IV medication once a month called Kisunla and enjoy life and retire healthy, right? So please listen to me, listen to my advice, because this will save your life. Remember that, as I said in another video, there is so much that your healthcare team will care about you. Nobody cares about you, and nobody can care about you better than yourself, right? Yourself. So you need to grab the bull by the horn. You need to insist. You need to be direct with your doctor in a polite, civil way. You need to ask questions, and you need to not allow your doctor, your nurse practitioner, your whoever the cazzo it is in your healthcare team to dismiss your symptom. They need to be investigated. You need to bring somebody with you to ask questions. If you go to your doctor next visit, bring your wife, bring your husband, bring your mom, bring your dad, bring your sister, bring your brother, bring whoever the cazzo you have who is an adult. Don't bring any kid. Bring an adult who can ask question, and alternatively you ask question. You ask question to your doctor, then your sister asks question. Then the doctor answers the sister, then your sister asks again, and then you, in the meantime, think about a question. Otherwise, the doctor gonna kick you out of his exam room very quickly. Remember, 5 minutes is the average time that a patient spends in the exam room with his or her doctor, whereas 45 minutes is the average time that a patient spends in the waiting room of his or her doctor. These are the official statistics of the Medical Association, American Medical Association, AMA. 45 minutes average time they wait in the waiting room, average, some more, some less. 5 minutes average time that a patient spends in the exam room. What can you ask? By the time the doctor comes in and look at the file and the results of your blood tests, and he doesn't even have the time to examine you, to sit down, to hold your hand, to look at you in the face, right? It's crazy. To answer your questions, to listen to you about this brain fog that you have, about this short-term memory loss that you have, about this failure of being able to concentrate. You know very well when you read a page, you start to read a page, whether it's online or in the book, after 2 minutes your brain is somewhere else while your eyes are still focusing on that TV screen or on that computer monitor or on that book. You are looking at the book with your eyes, but your brain is somewhere else. There's something wrong with you, right? It's not normal. When I read a book, my brain is concentrated for the 10 minutes on that book. Then every 10 minutes you need to take a break. You need to take a break, you go, you do this and that in your apartment or in your home, blah, blah, blah. After 5 minutes, you come back, you keep reading, right? You don't keep reading all the time like this endlessly, right? You need to give your brain a little break. But the 10 minutes where I'm reading a book or an article or a newspaper or a medical journal or a scientific journal, my brain is really focused on that and my brain is not wandering somewhere else. So if you have this kind of issue, if you're no longer the same, if you know what I'm talking about, right? Then do not allow your doctor to dismiss it and say, well, your brain fog is nothing, you are tired, you not sleep enough, get some caffeine, blah, 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 right? No. Doctor, you have to ask questions, you have to insist in a polite manner. And if you think, guys, that your healthcare team is not giving you what you deserve, means proper, individualized, tailor-made, custom healthcare, if you feel that they don't care, that they are rushing you in and out, that you are part of an assembly line of patients, 30, 40 patients, you have to change doctor. Not only you have the right to do that, but you have to do that for your own benefit, for your own health, right? Otherwise, you're going to regret it. Your cancer will be diagnosed too late. Your heart failure will be diagnosed too late. Your kidney failure, your liver failure will be diagnosed too late. Your dementia will be diagnosed too late. And as you know very well, it's no secret that whenever you detect a disease, a bad condition early, the chances of beating the disease are huge, right? You don't want to detect breast cancer, pancreatic cancer, liver cancer, blah, 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 blah. Dementia, heart failure, kidney failure, liver failure at a late stage, right? When that's it, you'll be done in a few months, you'll be dead, maybe in 2 or 3 years, you'll be dead. Then you're not going to enjoy your retirement, guys, right? My friend, my fellow citizen, whether you're a woman, a man, something in between, whoever the cazzo you are, I don't care. I love you. I care about you. I went to medical school 30 plus years ago, not for the money, not for the glory, not for the fame. And I'm here on YouTube for the same thing, for the passion to teach, for the passion to speak to my students, meaning you. I used to teach, by the way, to medical students, nursing students, MRI students, ultrasound students, right? In a classroom, right? But unfortunately, because of too much work, I didn't have the time anymore to be able to do that. So I gave up teaching, but now I am back again online. You are my students. You, the hundreds or thousands of people who are watching me, are my new students, and I love it. I do it for the love, the passion, to give you all this information in an easy way. My channel is not made to teach medicine, right? I'm not here to teach you the medicine, right? I'm here to teach you how to be healthy, how to stay away from quacks, charlatans, what I call healthcare scammers, right? If I wanted to teach medicine, then I will make my channel to teach young doctors, right? But I'm not here for that. My channel is for the average Joe like you, the average Jane like you, who don't know anything about medicine, right? But and I say that respectfully, but who want to age gracefully, stay away from diseases, cancer, heart attacks, strokes, liver failure, kidney failure, heart failure, blah, 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 dementia, neurodegenerative diseases, so that we can still be together in 50 years, God willing, and so that we can age gracefully. And if you want to retire, you can retire and enjoy retirement without being sick. Remember, 30% of Americans, 30%, that's almost 1/3, right, of Americans do not enjoy retirement because they are too sick. And despite having the money, they are too sick to enjoy retirement. Another third of Americans don't enjoy retirement because they are too poor. They might be healthy, but they have no money, so they don't enjoy retirement. And 1/3 of Americans are healthy enough and have enough money to enjoy retirement. So be in the part of people who are healthy so that you can enjoy retirement. Dr. B will never retire. I will keep teaching. I will keep online to you. I will keep working at the clinic 8 to 10 hours because I love medicine. Retirement is not made for me. Retirement is not, I love too much medicine. Medicine is my wife. Medicine is my girlfriend. Medicine is my child, right? So I don't have no wife, no kids, no girlfriend, no kids, no ex-wife, no ex-girlfriend, no nobody, right? My family members are medicine. My wife, my girlfriend is medicine. Anyways, whatever keeps people happy, huh? But I love you, and get back to me. Put your questions down there. Whatever the cazzo you have, any questions, any comments, blah, 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 I will get back to you. It might take some time because I'm so busy, but I will get back to you. I love you all. May God bless you, and I hope to see you in the next video. Bye-bye.